Good afternoon and welcome to the Department of Behavioral Health's weekly pandemic update. Dewan Utek reporting out. This is a week where we've had our first run of technical difficulties, and so we are recording this. It will not be held live. You'll be watching this recording. So we won't have a chance to answer questions during the recording, but please, as usual, send any questions that you have to myself or Tina Young, and we will either report back out to you and or include it in next week's update. All right, on to the report. February is Black History Month, and this week, actually tomorrow, we are having a couple of expert panel discussions that any of you are welcome to attend, centered on Black experiences. And so one of them is between 10:30 and 12 tomorrow. What is code switching? I highly encourage you to tune into this to learn more. I've read a little bit about code switching, and it's kind of a fascinating thing and something that it's important for you to understand. And then Black Wellness, a local perspective, will be from 12 to 1:30. So about 3 hours of panels, but split into two different subject matters. So tune in and contact Tiffany White if you have any questions. All right, on to COVID. Across the world, as of today, we have 110,164,028 cases of COVID, and that is also 2,436,173 deaths. In the United States, we're now approaching 28 million cases and almost 500,000 deaths. In California, we have 3.421 million cases and 47,924 deaths. Overall, our positivity rate is going down. We started at 4.6 or so last week, and we're at 3.2% across the state. A really welcome improvement from the past several weeks and months. In terms of Fresno's numbers, we now have 93,555 cases. Most assuredly, we will approach 100,000 cases during this calendar year. And we have 1,349 deaths. We continue to add deaths. And if you'll recall, we'll expect to see those deaths continue for a little bit because they typically lag as the cases go down. In terms of hospitalization, this is the first week in a while that we've seen the number of hospitalized individuals go under 300. If you look at this chart, you'll see that the last time this happened was sometime in late November. And we have 75 individuals in the ICU, and that leaves about 15 available ICU beds. So significant improvement. In the summertime, when we hit our peak, it was 313 in the hospital. So we still have a lot of people in the hospital, and that's something that we'll want to watch very closely. We have good news about our tier. We've been in the purple tier, we remain in the purple tier, but this is the first week in a long time that we've went in the red tier on one of our metrics, and that is on our positivity rate. So the positivity rate has to be below 8 to be in the red tier, and right now we're at 7.9. We are still in the purple tier with number of cases per 100,000 population at 22.8, but definitely the right downward trend, and hopefully in the next few weeks we'll get below the 7 mark and be able to go into the red tier. I did want to talk a little bit about race and ethnicity. This is a little bit of a hard graph to read, but this looks at our cases in Fresno County and compares the race and ethnicity representation in our community to the number of cases. And the population really that is disproportionately impacted by COVID in our community is the Latino population. They represent about 52.6% of our population, but they are 59.3% of the COVID cases. And if you look at testing, they're also underrepresented in testing. So about, again, 52.6% of our population, but only 43.9% for testing. And we know that individuals of Latino descent are also have a higher death rate. So it's really important for us to get the word out that if you are Latino, you should be getting tested regularly, certainly following those precautions, and hopefully staying away from COVID. In terms of vaccines in Fresno County, we've now administered 141,387 doses as of yesterday. A reminder that some of those doses are given to the same person, so some of us have gotten 2 doses. And so over time, that number will roughly, if you cut it in half, will represent the number of people fully vaccinated. At this point, we probably have something like 50 or 60,000 people fully vaccinated, and then the rest are first doses. So that's a number we'll be following closely. We did hear this week that some of our vaccine doses are being delayed by the storms, and so hopefully we do have a little bit in reserve, contingency, if you will, that we can utilize so we're not having to cancel appointments. In terms of who's been vaccinated in our county, you can see that, remember that we talked about 52% or so of our population is Latino, but they represent only 24.4% of the individuals vaccinated. So this is something we're going to have to really watch closely as we move forward. We want the vaccination percentage to represent our ethnic mix in our county. And so that will be a target population for us, are the different ethnicities, to ensure that we're broadly vaccinating across all ethnicities. You can also see on the left-hand side the age representation. By far, the highest percentage are individuals over 65, and that's great news because we're in their tier now. We want those individuals to get vaccinated. They're one of the highest risk populations for death. And then some of the younger represent our healthcare workers, law enforcement, et cetera, first responders. So this is something we'll be watching over time as well. In terms of vaccines in general, we don't really know the prevalence of the variants in Fresno County, although that is something under investigation. We are continuing to get more doses despite the delay in shipment with the weather. We've been running around 8,000 a week. Last week we got 19,000. This week we're scheduled to get 18,000. So if we can maintain that higher number of doses, it just accelerates the schedule of vaccination for our county, which is great news. A reminder that the Johnson & Johnson vaccine is up for approval next Friday, the February 26th. This is an adenovirus-based vaccine, and it is about 72% effective. There are also some federal efforts going on. So right now, the way that the vaccine is getting allocated in California is by county. The state actually is turning over that allocation process to Blue Shield this week. And basically, they make the allocation based on the number of people they expect that you have in each tier of the vaccine schedule. We're actually a county that has a smaller number of people who are elderly, over 65. So there is a disproportionality to how the vaccine's administered across the state. And so what we're arguing in Fresno County is 2 things. One, we've had a really high incidence of COVID, and we've had a disproportionate impact on some populations, like the Latino population I talked about. But in the meantime, outside of that allocation within the state, the federal government is making additional vaccines available. And so those efforts are in addition to what we get through the state. One of those is that we're still a possibility for a Fema mass vaccination site. And Fema is the Federal Emergency Management Agency, and they're the ones that respond to disasters, and the federal government is making these Fema mass vaccination sites available across the United States, really targeting communities like ours that have been the hardest hit by COVID. And right now there's one in Alameda County and one in LA, and they're looking at Fresno for a third site. So cross your fingers, say a prayer that we get that vaccination site. And again, that will be vaccines in addition to the allotment that we get from the state. A note about that mass vaccination site: if it is put in Fresno County, it is not exclusive to Fresno County residents. Right now, each county gets an allotment of vaccines, and you're supposed to only vaccinate people in your county because your allotment is based on your county's population. But the mass vaccination sites would be available to the region. Rite Aid and CVS are also getting some vaccines from the federal government, and they started their program last Friday. So some local CVS and Rite Aid have about 40 or 50 doses a day each, and individuals who fit into a current tier can go onto their websites and sign up to get a vaccine that way. And then the final thing that the federal government is doing is making vaccines available to federally qualified health centers to vaccinate underserved populations. And that could be underserved by geography, it could be persons experiencing homelessness, or individuals in the agricultural industry. And in Fresno County, United Health Center is a part of that program. And so that will bring in a few hundred extra doses a week to our area to help expedite the vaccination schedule. I did get a few questions after last week's presentation, and so some of them I answered last week, but I want to make sure that those people who had those questions get them answered. One is, what about the effectiveness of the vaccines on the new strain? A reminder that the effectiveness of the vaccines really is a measure of whether anyone who's had a vaccine develops COVID and experiences symptoms of COVID. And so the vaccines, Moderna and Pfizer, that are 95% effective, about 5% of the people who got the vaccine experienced mild symptoms of COVID. Very, very few individuals who participated in any of the vaccine trials had moderate to severe symptoms of COVID, and to our knowledge to date, no one has died who's been in a vaccine trial. So we do know that most of the vaccines appear to be roughly as effective as they are on in the testing of the vaccines to the new variants that come from the UK, Britain, as well as Brazil. The South African variant, most of the vaccines have some effectiveness against, but it's a little less effective. That doesn't necessarily mean it's not effective. It just means that more people will develop symptoms of COVID. All of the vaccine manufacturers are developing new formulations of their vaccine to address the particularities of each variant. There's some minor changes that each variant produces that make it harder for the vaccine to work. And so, one of the things we know about viruses is the more prevalent they are in the community, the more likely that a variant will develop. So this is one of the reasons why, we're advised to wear masks and stay apart and certainly get vaccinated, is we reduce the incidence of the disease in the community, which also reduces the possibility that one of these variants will emerge that is harder and harder to fight with vaccines. And so, those are really important things to keep in mind. But right now, we think the vaccines have some effectiveness, and they will continue to develop new formulations to be even more effective. How long does the vaccine provide protection? Well, what we know right now is that about 90 days is assured of having protection. And the reason we don't know more than that is because we're only so far out from those trials occurring. And the proof is in the pudding, if you will. And what I mean by that is they'll be watching people very closely, both who were in the vaccine trials and received the vaccine, as well as those of us who received the vaccine in the general community. All of us continue to be exposed to COVID, and while the incidence is going down, we still could be exposed to COVID. So over time, they will look at those populations who've been vaccinated either through the trial or in the community, and they will see if we get COVID. And if we get COVID, what are the symptoms like and how bad is it, and do any of us die? And so over time, we'll be able to tell as we get further and further from that vaccination time how many of us get COVID. And just like I mentioned, that 5% that with Moderna and Pfizer that still could get symptoms of COVID, they'll look each month, each day, each week, they'll be measuring that. How many of those people got COVID? How many had symptoms? And over time, they'll be able to see, does that number go up? Do more people get symptoms? And how long does it take over time until more people get symptoms? So what we might learn is that we keep that same level of effectiveness for 6 months. Or we might learn that we keep a certain level of effectiveness, but it goes down over the time. And so all of that remains to be seen. And it's simply going to take time and that research to understand how long people have protection from the vaccine. A reminder that you get more protection from the vaccine than actually having COVID. So those are all things that will be looked at as we move forward. In terms of the variants impacting our return to working in the office, basically the thing that will impact our return to working in the office is getting out of this emergency situation we're in. And I'll talk about a little more about that in just a second. So I have been asked about telework and how long it will be continued. Really, the telework is a basis of the emergency situation, the state of emergency that we're in. Until that state of emergency gets lifted to some degree, there will likely be some telework that continues. And the things we'll be looking at are, what tier are we in? Thus far, since we developed the tier system, we've never gotten out of the red tier. We've been in purple, we've been in red, but we've never gotten into orange or yellow. And orange and yellow are really where you have very little, particularly yellow, very little COVID in the community, very, very manageable, etc. And so that's the type of thing that I would expect the emergency order to begin to be lifted and those discussions to occur. What will impact that are vaccinations and the variants. So if the variants become prevalent in our community and they're more infectious and the vaccines are not quite as effective against them, it is possible we could see a surge. It's going to take a while until we have enough people vaccinated to reach that herd immunity, so we could have a surge even without the variants. That's why it's so important, whether you've been vaccinated or not, to continue wearing your mask, continue to practice that physical distancing, limit your interactions with people outside your household, etc., even as the tiers change. And then we'll really be looking at vaccination. As we get more and more people vaccinated in the community, we should expect to see the incidence of COVID go down, even with a variance, the different variants in the community. So a reminder, too, that testing is ongoing. It's really important for people to continue to get tested. We simply won't know the prevalence of COVID in our community unless we're doing testing. They're even recommending, if you've been vaccinated, particularly if you develop symptoms, you should be tested. And the testing made available to the county is available to your families as well, so encourage them to get tested, particularly if they have symptoms. And with that, I don't think we're going to have any questions because we're recording this, but a reminder to please submit any questions you have after you've viewed this recording, if you have any questions or concerns. And also don't forget about the expert panels we have tomorrow in honor of Black History Month, and learn a little bit more about code switching or wellness in our Black community in Fresno. I hope you have a great weekend. Stay safe, wear your mask, keep your distance, and we'll see you next week.